Hello everyone, welcome back to my YouTube channel and I am Smriti Bhatia, and in today's video we are going to study about the functions of the nerves in a visual form so that we can remember it for a longer period of time. So before starting, if you are new to my channel, then hit the subscribe button below, and if you want easy notes of the topics that I make you study or that I teach you, then please do follow me on Instagram, and my ID name is already written over the screen. So starting with this, starting with the functions of the neuron, or starting with the practical form of the neuron, let us start with knowing that how the nerves originate and how they travel all the way through the body. So suppose this is, let us not suppose this is the spinal cord of our body. Okay, all the nerves originates from the spinal cord except for the cranial nerves. Okay, so we have 31 pair of spinal nerves. Okay, and we have 12 cranial nerves in the body. Okay, so these spinal nerves originates from the spine and supply various parts of the body, including the upper limb and the lower limb, except for the face and the head. Okay, cranial nerves supply the face and the head. Okay, so starting with this video, I want you all to know that in this video we are going to cover about the functions of the spinal nerves. Okay, like how they travel and what happen if they are hampered, if their conduction is lost, or like if they are either if their conduction is lost from here. So what will happen, we will discuss that. Okay, so starting with it, this is the spine. All the spinal nerves originates from within the spine. We have these vertebral columns. Okay, so these all are vertebral columns. In between the vertebral columns we have the disc. Okay, that act as the shock absorber. Okay, so disc helps in shock absorption. So this shock is a weight bearing. Okay, now what happens is that the nerve exits the spine and travel through the upper limb or the lower limb. Okay, so these are the nerves that exit the spine and supply the skin and muscles of the limb, right? So as we have already discussed that nerves are of two types, motor nerve and the sensory nerve. So the motor nerve helps in the supply of muscles and sensory nerve helps in the supply of the skin. Okay, so now suppose let us okay, so now this is the motor nerve that is supplying the skin. Okay, oh sorry, motor nerve that is supplying the muscle. So what will happen if this gets compressed from here or from here due to the disc bulge? What will happen? Now if the nerve gets compressed from over here, the tingling sensation will start all the way over here. Okay, so in case of the motor nerve, we will see muscle weakness if the nerve gets compressed. Okay, and in case of sensory nerve, if it gets compressed, we will see tingling or numbness. Okay, first of all, tingling is seen, and after that numbness is seen. Okay, so now all these things, that includes the tingling, the numbness, or the weakness of the muscle, these all are the features that are seen in the peripheral nerve lesion. Okay, but this is a very different topic that we will study later on. So coming back, in this video we have already discussed the function of the nerve. Function of the nerve we have discussed in earlier videos. In this video we have only studied about that how the nerve exits the spinal cord, how it travels to the muscle, how it travels to the skin. Okay, one thing I want you all to know, that there is a motor point in each muscle. So this motor point is the point on the muscle that in which the nerve enters. Nerve innervates the muscle. Okay, so motor point is the point at which the nerve innervates the muscle, and it has the maximum contractility if we stimulate it. Okay, so that's all the things that I want you to learn in this video. So if you like the video and if you want more content like this, then don't forget to hit the like button below, share it with your friends, don't forget to subscribe my channel, and if you want any new topic that I should cover, then please do comment in the comment section below. Till then, keep studying, keep learning. See you next time.